This meeting is being recorded and or transcribed.
All right, you should be able to see my screen. We'll go ahead and get started. So again, I just ask everyone make sure that you are muted. Thank you. All right, the call today is for our school and health department staff. We will record this and post the slides and the recording on our website within the next few days. Otherwise, if you're not with our schools or health department, I'd ask you drop off the call. Make sure you pass along any needed information to the rest of your staff. Getting right into things, I do have quite a bit of information to share, and I want to make sure we have time for questions and answers. So our first slide I did take from the state, just kind of an update of kind of where they see the guiding principles kind of from this point forward of, you know, our goals from this point forward and how they're making decisions based on them. So our first goal with COVID-19 is to prevent death and severe outcomes. And so in order to do that, we want to prioritize vaccination and boosters, focus on protecting our most vulnerable individuals, and make sure that we have access to testing as well as the newer treatments that continue to become available to us. The second thing that we want to do is make sure that we help protect our healthcare capacity, whether that's our ambulances, our hospitals, our nursing homes, places like that, from becoming overloaded and strained. So that is where reducing community spread comes into place, especially during surges, and reducing the severity of cases so that our ICUs are not overtaxed and we don't run out of things like ventilators and therapeutic options. And the third thing, excuse me, is we want to keep our vital infrastructure functioning the way we want it to function. Schools are a part of that, as are many other things. And so we want to be able to have kind of a new normal that can allow things like our schools to continue to function regardless of what we're dealing with, whether it's a surge, whether it's a lull. And so we have to kind of look at what they refer to as a risk budget. So what gives us the best benefit for the lowest risk possible, and you know, really be able to provide tools to the public to help them protect themselves, like high quality masks, testing, instructions on how they can take care of themselves with isolation, notifying their contacts, things like that. So these are the kind of the three guiding principles that the state is now looking at kind of from this point forward and how they're making recommendations. I'm sure you all did see, or you know, hopefully did see. If not, I did put the link here. The state did update their mask guidance on the 16th of February. It has been suggested that the CDC may make some changes to their mask guidance and release that this week. I continue to watch for that, but have not seen anything new yet. So one thing they mentioned was, you know, looking at COVID moving forward as being in one of three phases, whether we're responding to a surge and, you know, making adjustments by increasing masking, testing, social distancing, other responses to respond to a surge, whether we're in a recovery phase, which would be post-surge, and we're not really expecting another resurgent to come. We're watching what's happening. So that's the stage that it's felt we're in right now. The third phase is readiness, where we're expecting a surge to come. You know, maybe a new variant has been found in another country, something like that, and we're expecting a surge to come our way. So we're kind of expecting that to happen. We're making plans. We're communicating those plans. I know this is very busy, but the key points here, the state continues to recommend that we do use layered mitigation strategies. We use as many of them as we individually feel that work for us in our situation. So, the most effective is vaccination. So making sure we're up to date on our vaccines. Therapeutics is the second thing. I got an email just before getting on this call discussing that we really are not facing a major shortage of therapeutics or the monoclonal antibodies or the pills that are available to treat COVID at this point. So that is really good news. There's many people that they're available for, basically people who have risk factors for severe illness, and I'm going to list those later. It's very extensive. So for those who do have COVID, you're making sure if you do qualify for these medications, again, the pill is now available at all Meijer pharmacies and many pharmacies besides that. So isolation and quarantine is still very important, especially isolation. Anyone who's sick or positive, staying away from others so you don't infect others, getting tested if you have been exposed or if you are symptomatic so you know how to best care for yourself and your family. They mentioned taking additional steps to protect yourself and others. They do put a link there, but I went to that link, which is the CDC, and listed those out that have not been already mentioned on the slide. And those other steps include wearing a mask, staying 6 feet away from others, good ventilation, washing hands, covering coughs and sneezes, cleaning and disinfecting, watching your health symptoms, and being careful when you travel. So it's just all those other things to do as you're able to. And then they also mention making available to yourself the free high quality masks that are at many different locations throughout the state. So NDHHS did state that school districts and organizations should consider their local conditions and work with their local health department to determine mask policies for the school districts and for public meetings and large events. They also did state that any individual, regardless of vaccination, still need to wear a mask during isolation and quarantine periods to stop further communication. So their discussion about masking changes did not change the recommendations of isolation and quarantine. So those people in isolation should be wearing a mask when around others from days 1 through 10 after symptom onset or test positivity if they had no symptoms. So when you're allowing students or staff to come back after day 5, they do need to be masked still. I know there's been some confusion about that, but those individuals, about 1 out of 3 of them will still be contagious after day 5. So it's very important that masking be encouraged in those individuals. I know that can be very hard to police and to enforce, but it really needs to be encouraged, or else that shortened isolation period just doesn't work. And same with quarantine. Individuals in quarantine are to be masking when around others because, again, they can be contagious from days 1 through 10 and very rarely even up to day 14. So again, when they come back to school after day 5, they are to wear a mask through day 10, again, as best as you can enforce it. So these are just some visuals that the state recently put out explaining this for isolation and for quarantine. And then these are some visuals that the CDC just put together. They're from their clinical guidance for vaccination, but I thought that they were pretty good visuals even for lay people, just to try to better explain what a primary series looks like with the booster dose in there for different age groups. And then the second, and they did just make a change in the recommendations for the mRNA vaccines that the second dose can be given between 3 or 4 weeks to 8 weeks. The longer duration or the longer spacing is suggested for young males, particularly just because there is a very, very small risk, but a slight risk of myocarditis with the mRNA vaccine, still much, much lower than the risk with COVID infection. But on the next slide here, they did make some changes to the recommendations and spacing and dosing intervals for those who have significant immune compromise. Again, you don't really need to know this. I just wanted you to have this reference here if you personally or anyone in your family have these issues, or if you're dealing with a population that has a lot of immunocompromised individuals, just so you have it as a reference. But again, when you're dealing with quarantine, if you need these references, again, we're getting to a point where, we're trying to decrease your burden. So even just taking people's words for it, or again, checking MICR for your students is adequate. So the CDC, again, we're hoping to see some better guidance or clarification soon, as to when they foresee some changes in this, but they do still recommend universal masking in all students, staff, and teachers in K through 12. In the general public, they recommend universal masking when there's substantial or high community transmission. So with the school setting, they don't have that qualifier regarding community transmission rates. So again, hopefully we'll get some clarification on that. And they also encourage people to wear masks regardless of community transmission, just if you're at risk for severe disease or you have poor immune system, you're not up to date on your vaccines, or again, you just want to protect yourself. So regarding the community transmission rate, I pulled this data just a few hours ago. We'd want to be in these red boxes. Both of these indices should be these red boxes per the CDC at this point to remove that recommendation. Our percent, this is the yellow box is the CDC way of measuring things, and the purple box is our Michigan way of measuring things. But our percent positivity is at 7.7%, so just below the 8% the CDC wants to see, and then for Michigan, it's below 10%. But our case rates have been dropping very rapidly, but are still above the, whether it's 70 daily cases per million or 50 weekly cases per 100,000, depending on which organization you look at. You can see that we're still significantly above that. Again, if things continue the way they are, we should be below that quite soon. Again, we'll hopefully get some guidance from the CDC about what they recommend for schools. But from a public health standpoint, masking is still a recommendation in school settings. And this will continue to be recommended in school settings until we have further guidance and until the amount of COVID in our areas decrease a bit further. But on the whole, whether it's for schools or statewide, as Michigan just made their changes, the rationale for some of these changes is just we have more slices of Swiss cheese, so to speak. We've seen those graphics of those slices of protection or mitigation factors. So now we do have, we have 2 FDA-approved vaccines that can be used, and one that can be used in ages 5 and up. So essentially, our K through 12 population has vaccines available to them that are very safe and effective. We now have availability of high-quality masks. Before, those high-quality masks were really only available to healthcare providers, but now we have enough to be available to everyone. And they have been shown to protect against infection in those who are using them, not just protecting against spread of infection from sick people wearing them. We have widely available testing, whether it's for screening or diagnosis of sick people, and we have medication and more types of medication available to treat infection. So once we add more and more slices of cheese, we can look at removing some of the less desirable slices of cheese as individuals feel comfortable doing that. It's not mandatory, but we know that masking in school is not as favorable for some people, and so schools with mandates can consider ending those at this point. But it is still recommended that schools recommend masking, or at least don't say that you don't have to mask. And make sure and advise your families that masking mandates or masking encouragements may have to return if another surge occurs. So if we have to go back into those response phases, or even short term for 2 weeks or so, if you have an outbreak in your school and it's an alternative to closing your school. So I would encourage you to just be clear with families that, yes, you don't have to be as vigilant about masking now, but we might have to go back to that just to keep kids in school. It helps to kind of keep that communication so that you don't get roadblocks in the future. So at this point, again, because we can add in those extra layers of protection, your parents of the students and your staff who really want to protect themselves have the ability to choose to get fully vaccinated, choose to wear their mask. Obviously, it's a little challenging for students once they're at school where parents aren't there to keep them wearing their mask. But I would ask that you do support your students and teachers that do wish to wear masks. And if there's any bullying or discrimination or anything against students that do choose to mask, to really crack down on that. So again, recommendations may change and evolve with time if we have new variants, if our healthcare system gets bogged down, but this is where we're at right now. So this is just a graphic from the state just showing different risks from the setting. So, outdoor well-spaced is the lowest risk, indoor crowded with bad ventilation is the highest risk, and then, an unvaccinated person with risk factors is at highest risk. And so most school settings are going to be indoor, whether they're providing a lot of space between people or not, whether they have good ventilation or not. Every school is a little different. Whether you have mostly vaccinated, mostly unvaccinated, healthy students, healthy staff or not, kind of depends where on this line you end up. I just wanted to provide this. It's very, very busy, but just to give you an idea of the medical conditions that put people at higher risk for severe illness with COVID. It is a very long list. This is from a medical or scientific review. The items in these first 2.5 columns are the ones that there's extremely strong evidence showing that they do greatly increase the risk for severe COVID illness. This little one here under suggested has good but not as strong evidence. And this last one has some evidence that's just not as supportive. But anyone with any of these categories would qualify for treatment if they were to have COVID to prevent them from needing hospitalization. So again, if you're overweight, if you have asthma, if you have high blood pressure, call your healthcare provider if you're positive for COVID and see if you can get treatment for COVID to help reduce your risk of serious illness. So I really quick want to go through this. This is a great summary of information. I've talked about the ABC Science Collaborative before. I did put a link here. They have this, I put a few slides here, but they have all the slides, also a nice summary put together, and a 30-minute presentation that their scientists did that's just great. It really is put together specifically for schools, so it's focused right towards you. But it's a great review of the data that they have pulled together from studying many, many, many schools and over 1 million students and staff. But just a summary, looking at hospitalizations following whether it's COVID, RSV, or influenza, whether kids are vaccinated or unvaccinated for COVID, looking at the fact that in older kids especially, the risks of needing to be hospitalized from COVID, if they're unvaccinated, is much higher than the risks from things like RSV or influenza. So I know, a lot of people think, well, it's not that serious in kids, but it is still, more dangerous and more harmful of a risk to our young people than most common illnesses. This is just demonstrating where COVID stood at different points in 2021 in terms of the leading cause of death. So for example, in October of last year, it was the #1 cause of death for people that were 45 to 54. Overall, it was the leading cause of death last January and February for all ages, averaged out. But just to show, in our young individuals, the 15 to 24-year-olds, was in the top 5 for most months. It was in the top 10 for our young individuals for most months as well. So just a good summary. They do a very good job explaining this data, and there's other slides explaining the research behind this. But just to be brief, this is just the end of that discussion. Again, they did very large collection of data from many, many schools, and again, over 1 million students and staff, finding that schools with full masking had 70 to 80% less secondary transmission or in-school transmission of COVID. And they were able to kind of deduce some coefficients where you could kind of figure out what your risk would be. They put together this table mainly so you could make some decision making as cases change in the community. So this is not a real scenario here. This is hypothetical to give you some numbers so that you could think things through. If you're deciding as surges reoccur, should I reinstitute masks? Should I encourage masks more strongly? This is saying, excuse me, if I have 10,000 people in my school district, I know many of you don't have that many, but if you want to move your decimal point over by 1, if you have 1,000, that would work. So if we're almost to 100 cases per 100,000 per 7 days. So that would be that CDC number. So if you had mandatory masking in your school, you would expect to see about, if you had 10,000 students in your school district, you'd expect 10 cases within your school district, and you'd only expect 1 case secondary transmission in your school if you had universal masking. If you didn't have universal masking, you'd expect about 4 cases. And then they'd expect then that those 4 cases would lead to at least 1 case in a household. So they'd go back home and spread it to 1 person. And then that would lead to 6 more cases between those 4 kids and that 1 household member, 6 cases in the community. So you can see as the community rates go up, the number of cases in the school go up and the number of secondary cases go up. So it uses the rates that they found in their study and just gives you an idea so that you can determine what risks work for your community. Again, this is all just math. It's not necessarily real world, and it takes into account all infections. You may say, well, we never see that many. Well, you're not testing everybody. You do have asymptomatic infections, or you have kids that are sick that just don't get tested. So again, that kind of takes that into consideration. So just a tool. So the rationale, they talk about how our rationale for masking has changed a bit since we do have vaccination now. Vaccination has, reduced the risk to people in terms of getting COVID. The risks of COVID to people, to younger individuals, is overall quite low. But there are some individuals who are not low risk. So kids may expose older individuals or people that are at higher risk. And we also have to worry about our community in terms of overloading our hospital systems, but that is getting much better. They discussed how in many areas, masking did help keep schools open. They were talking mainly from North Carolina because that's where Duke University is. They did actually have some legislation pending that would not allow just community rates to make a decision to keep schools open or closed. We never really did that. Decisions were made more on a school level, not on a community level. So their conclusions were that mask use in a school did reduce the spread of infections of COVID in a school. And, they cited that, that's why healthcare systems have you wearing masks still at this point. But as the pandemic recedes, and hopefully will continue to recede, that you need to do what's best for you and use the data that they've provided you to help make those decisions. So we also have vaccines available. We have antiviral medicines that are available, and those medications are available to kids down to age 12. So again, this information is just there to help you make educated decisions. Another resource that was just recently shared with me was another good slide set with a lot of good data. You can find it at urgencyofequity.org. This seems to be from a group of professionals and organizations that are very pro mitigation measures, so very pro masking. And so it may be a bit more biased towards that, whereas the other one, I'm more confident is much more scientific. So I'll just preface it by that, but I just wanted to share the link in case you have interest. This is just another shared thing. The CDC did update this website on self-testing. This is just the beginning of the page, but as you scroll down, there's a lot of videos on how to self-test. There's links to all of the approved home tests and, lots of instructions on how to use each and every one of them. So just a resource for you. Getting into our data reports, you can find your local data at the mystartmap.info. The state data and modeling update for this week. This first slide I pulled from the CDC. This is the United States data from the beginning of the year, over the last year, basically from January of 21. And these are the absolute cases per day, so the total number of cases in the US per day. This is Michigan, even though it says 01 here, this is actually, I don't know why it messed up the dates like that, I checked it twice, but this is January 2001 to January, it must be the day, but this is January 2021 to January 2022. This is today's date here at the end. So it's the same time period, but these are cases per million population in Michigan. And I kind of put them over top each other just so you could see our patterns. So we're pretty much following the US pattern. Again, we have totally different axes here, but just to see kind of how we match up. And we seem to be declining at about the same pace as the entire country. So this is just showing the last 3 months here, and our percent positivity is down to 9%. I remember when it was back in the 30s, so that is a big improvement. Our daily cases per million in Michigan overall is 292. This was from a few days ago. Again, I just showed earlier it was quite a bit lower than that already. And 10% of those hospitalized in Michigan are hospitalized due to COVID. The ages are all kind of clumping up here, but the highest age rates are the 30-year-olds, followed by the 40-year-olds and the 20-year-olds. Our hospitalization, number of people hospitalized due to COVID has dropped significantly, but still definitely not down to our lowest points yet. Same with our ICU hospitalizations, pediatric hospitalizations as well, decreased, but still high. So this was a report from the CDC just showing the effects of Omicron on pediatric hospitalizations. This shaded area is when the Omicron variant was prominent, and this dark blue line is the hospitalization rates for 0 to 4-year-olds, followed by 12 to 17-year-olds, followed by 5 to 11-year-olds. So did seem to really increase the rates of hospitalizations in the youngest individuals. I just added this on here. This is the multi-inflammatory syndrome in children counts for Michigan. There's been 263 total cases in Michigan. You can just kind of get an idea of how many there have been more recently. And, you know, there tends to be a few months delay on it. So we would expect to see more coming as a result of the Omicron surge, but just to give you an idea of the increase we've seen recently. So Michigan is seeing pretty much 100% of all genotyping or variant testing is Omicron. We have not had any of the BA2 identified in Michigan. That's kind of the subvariant of Omicron. The US as a whole has had about 3.8% identified. Hopefully we will not see that become an issue, but that is what we've seen throughout the US. So these are those projections. Our weekly cases appear to be decreasing kind of ahead of schedule. Hospitalizations are a little more on the pessimistic side, and unfortunately our deaths are still on the pessimistic side. So these are cases in the dark black line. The dotted line are the number of cases in people that are fully vaccinated. The dark blue solid line are the people that are up to date on their vaccine, so have had a booster and have had cases. So you're 5 times less likely to get infected if you are, you're 5 times more likely to get COVID if you're unvaccinated, is how they've figured the numbers there. And over here is death rates. You're 88.5 times more likely to die from COVID if you're unvaccinated in Michigan. We mentioned this a couple weeks ago. AccessCOVIDtest.org is providing free home COVID tests. This is separate from the other program through the Postal Service, providing it to certain areas. They've extended the areas that they're providing to. The dark blue areas are the zip codes they're providing to. You can go to the accesscovidtest.org site, enter in your zip code, and see if you qualify, but it's just another resource for you and your families to get free home COVID tests. So that is all I have. I know that was a lot, but let me get this back up. All right, so I'm gonna start going through the chat. If anybody has, sorry. Brooke, do you need me to still share a slide? Sorry, I didn't see that because I had my slides up. But if you need me to still share a slide, type that in the chat for me. If anyone has a question, please type it in the chat. Oh, go ahead.
I think it was slide 3 or 4 towards the beginning, please.
All right. Yeah. Sorry, it doesn't scroll very fast. Okay. So this is slide 4.
I think it's after that one.
Okay.
No, nope.
That one?
No, there was a table.
It had a table on it. This one, please.
This one? Okay. So these are the recommendations for, the recommendations for quarantine.
And then if you could go back to the one, just one back for a hot second, that'd be great. Thank you.
Yep.
Okay, we're all set now. Thank you so much.
Yep. Yeah, no problem. All right. And then, do you think case numbers going down are a reflection of more people doing home tests and not reporting positive cases? And that's interesting because I read just before this call too, somebody from the World Health Organization was concerned that just overall decreases in testing may be an issue as well for the decreases in cases. But certainly both those things may be a factor, the increase in home testing, as well as people just feeling like, well, things are much better. I have a stuffy nose, but it's probably not COVID. I don't need to go get tested. So those are always concerns that we have when we start seeing trends like this. So most health departments, I know a couple of my health departments, well, I think all three of the health departments still do have a way for people to self-report their COVID, even though it's not necessarily reportable to, you know, those final numbers that make it to, you know, the CDC dashboards or whatnot. We still do accept reporting of the home tests just to keep an eye on those numbers. And we do send them on as kind of a batch report to the state, just again, to keep an eye on that. So you can certainly encourage people to go to our websites and do that. The other is to continue to encourage anybody you know, whether it's your students, staff, family, whoever, to get tested if they are having symptoms. And our community testing locations are still testing. You know, if we are seeing a big drop in people that are attending those, and if that continues, we may have to cut back on hours, but definitely continue to push testing for those who do have symptoms and those who have been exposed. Any other questions? I'm surprised we don't have a lot of questions today. If you're on mute, if you're on the phone and want to ask something, feel free to unmute yourself. Otherwise, if there are no questions, we will get the recording today and the slides out to everyone and also post them on our website. All right, guys, if you have any questions, let us know. If we have any updates before next Thursday, we'll let you know, and we'll see you next Thursday, same time, same place. Have a good weekend.